In Kenya alone, we've trained over 45 journalists.
This training came in handy.
Every aspect of the training was being conducted online.
Pia iliniweza kuniongezea wale watu ambao pengine wataalamu ambao ningetaka kuzungumza nao.
After the trainings, you could see more stories popping up.
They don't look at it, like a story that cannot make a headline.
Non-communicable diseases, also known as NCDs, have emerged as the silent epidemic of our time. These diseases are lifelong conditions that affect millions of people globally. NCDs claim lives, strain health systems, and impact economies. But why are non-communicable diseases important? According to the World Health Organization, NCDs are responsible for 3 of every 4 deaths in the world, which is about 41 million deaths annually. In Kenya, non-communicable diseases are responsible for 4 of every 10 deaths and more than half of all hospital admissions. These staggering statistics underline the urgent need to amplify conversations around non-communicable diseases. But statistics alone are not enough. It takes powerful storytelling to drive awareness, inspire change, and influence policy.
The NCD Alliance started training journalists around 2020, during that time then we had COVID-19, and it was practically difficult for us as an organization to reach the community with our intervention as normal through physical meetings. And we thought since local radio and even TVs and newspapers reach the entire community without necessarily organization moving to the community, as it was practically difficult.
People are confined in one place, and then you'd have stories of those that have NCDs or are suffering from the different diseases that are non-communicable, that there are cases arising in terms of medication, in terms of how they can access health facilities now that people were locked down. So I think that is one thing that made the training become more impactful, because that is when the NCD team was able to give us, the information that we need at that particular time and season to be able to tell the stories very well, not the normal way that we just used to tell. You do a feature, you feature a person suffering from probably diabetes, probably cancer, and then that's it. But then there is this another angle that comes where this particular person is not able to access the services or the medication. How else can they be able to access those services?
Kando na kuongeza mafunzo kwa kile ambacho nilikuwa nakijua, kwa sababu nilikuwa mwanahabari tayari, pia ilinisaidia kutangamana ama kuungana na watu ambao ni wataalamu katika sekta mbalimbali. Kwa hivyo inakuwa ni rahisi pengine kama unataka kufanya taarifa pengine kuhusu ugonjwa wa figo, pengine saratani, kisukari, inakuwa ni rahisi kumpata mtu kupitia hayo mafunzo. Sasa kando na kunifunza vitu ambavyo nilikuwa sielewi wakati huo, pia iliniweza kuniongezea wale watu ambao pengine wataalamu ambao ningetaka kuzungumza nao katika uandishi wangu.
This training came in handy because I just got into my career and immediately began doing health journalism. So it was a very good opportunity for me to learn how I could now tell non-communicable diseases stories.
It was quite an experience, considering that every aspect of the training was being conducted online. And during that time, though before I had been writing about health, NCDs included, I got an opportunity to try and specialize on NCDs coverage, which was quite an experience for me.
Sasa katika kufunzwa ama katika hizi training ambazo tulikuwa tunafanya na NCDAC ilikuwa ni rahisi. Kwa mfano, unajua kama ni mgonjwa wa kisukari, si kuelezea tu, unaweza zungumza na yule ambaye anamhudumia, unaweza zungumza pengine uangazie pengine anapata tatizo gani kumeza dawa, maana anahitaji nini ili kuhakikisha kwamba maisha yake ya kila siku yanakuwa sawa. Kwa hivyo training kama hizo zinakusaidia kwamba unajua ndio maradhi haya yako, lakini kuelezea kiundani na kuhakikisha kwamba wale ambao pengine ni waathirika wanapata usaidizi ama taarifa zao zinafika pale nje.
In Kenya alone, we've trained over 45 journalists, and these journalists, we have established a network of journalists that who currently have now capacity to conduct awareness and also to document NCD stories.
You go do these stories, but because you've not interacted with anything about NCD, or even don't know what NCD is, for me, I just based my reporting or my production on disability. But later on, after I've been introduced to these trainings, then you come to understand, oh, so this is what caused this, and this is NCD. At least you know something more than what you used to do. So actually it has helped me even when I'm reporting or producing my stories. I look, it's like I'm killing two birds with one stone, creating awareness on NCDs and at the same time creating awareness on disability.
Well, according to the World Health Organization, Kenya continues to face a rising burden of diabetes, key factors being obesity, physical inactivity, and unhealthy diet. 1 out of 3 people in Kenya are living with diabetes.
Nearly on a daily basis today, if you look at the impact, is that at least we have a story about NCDs, either looking at the impact of NCDs, the financing for NCDs, through various media, either through TV, print media, social media, amongst other strategies that have been used. Yeah, so currently the journalists have been reporting, and they are effective in terms of creating awareness.
I've done stories on diabetes, that is a diabetes type 1, diabetes type 2, and also the diabetes that occurs during pregnancy, hypertension, epilepsy, Down syndrome, sickle cell, cancers, basically just covering different types of cancers. So I've done a couple of stories, like I can say I've covered almost all the non-communicable diseases, or rather told stories of most of the NCD stories that are affecting Kenyans.
Before we started the trainings, maybe, I don't know if it's because I didn't know anything about NCDs or I didn't interact with other health journalists who are doing this, but after the trainings, you could see more stories popping up. Whether it's newspaper, I've seen a number in the Star. I've seen a number on NTV, I think. Yeah, NTV. And I can say that the trainings created more awareness, not only for us as individuals, but also in our workspaces. More journalists were now able to report on them because they are trained on it. They are told what it is and maybe how to approach such stories. So I can say right now there are a number of stories. We are not yet there, but compared to when we started in 2020, I've seen a lot.
I got a chance to empathize, not just reporting, not just being or reporting as an outsider, but getting a chance to empathize, getting into the lives of the people who are being not just suffering from the disease, but those who are indirectly affected by the disease. That was one aspect of the training, or the impact the training had on my reporting. I also had a chance to get an experience in terms of learning about the science aspect of these various conditions, and also getting a chance to talk to the experts and to know how to quote them in such a manner that I don't lose the audience.
I think it has become a bit easier after the training, and even for themselves going through the training. At least they have an overview that when you come with a story, an NCD story, they don't look at it, like a story that cannot make a headline. Yeah, so I think this time round it's a bit different vis-a-vis the normal way that reporting has been done.
You're listening to 96.9 FM, the home of fresh and classic hits.
The interviews were mostly live interviews, so you'd get feedback immediately. Yeah, so questions were risen as in how can I, get to know if I am diabetic, what are the symptoms, how can I go about it in terms of my diet, because now there was the option of if you want to to live healthy, then there is the part of the diet. So what is the diet that I'm supposed to take on so that I can live healthy even as I'm diabetic? Other stories that we've done is concerning cancer, the different kind of cancer, even children suffering from cancer, and the impact also was the audience who really, asked questions for the guest who was here, because it was also a live interview, and they also had their questions concerning, if a child is suffering from cancer, how do they go about it? How do they, go for checkup even before they get to realize that they have this condition? And then also mental health. We have done the stories for mental health in a very great way, and the impact has been really, really good.
Sasa kama mwaka jana kulikuwa na siku hiyo ya uhamasisho wa ugonjwa wa kisukari, tuliweza kuzungumza na binti wa miaka 22 ambaye amepatikana na ugonjwa huo anaishi nao. Ilikuwa ni taarifa tu ya kuhamasisha watu kwamba maradhi haya yako, lakini ukipatikana nayo si kwamba maisha yako yatakuwa yamesimama. Kuna vitu ambavyo unaweza fanya kuzingatia ule ushauri wa daktari na ukazidi na maisha yako, ama ukaendelea na maisha yako jinsi ulivyopanga wewe mwenyewe. Kwa hivyo tulizungumza na yule ambaye anaishi na ugonjwa huo, mtaalamu wa lishe na daktari.
Journalists have, through their reporting, they have created really a huge impact. So for instance, there are a number of issues that can now be highlighted by the Ministry of Health. Of course, now in terms of creating awareness, we are aware that a huge number of population has now been reached through continuous education. We are also aware that there are policies that have already been shaped. Currently now we are talking about issues of SHIF and UHC. We've seen a lot of change and also stories that have been highlighted in terms of the positive and the negative sides of these policies. We've also seen responses that have also been given by the policymakers, and this has only happened because of the continuous stories that journalists have really continued to highlight. Today, we also know that at least we've seen a growth in terms of financing for NCDs.
We believe any story that goes out there that is published or is broadcast has the ability to reach policymakers. When you do a story and perhaps the next day or the next coming weeks you find an issue that was highlighted in your story is being addressed, then it means that something happened.
At the time when we started training journalists in 2021, there were very few journalists who were interested and who were engaged and were motivated enough to be able to do NCD reporting. As we all know, an NCD has really not been really an area of interest for many organizations, and even in terms of media organization to do reporting. So as a strategy of really creating impact or attracting media organization and journalists to be properly engaged in terms of reporting and community education. NCD Alliance came up with awards as a strategy to be able to really to facilitate this. And this was done in around 2020, 2021, where we had a few journalists who were recognized.
Na nitakuwa ni pengine ni tuzo yangu ya kwanza kushinda katika muda wote nimeketi katika wanahabari. Sasa ni kitu ambacho kilinipa moyo. Kwanza kuendelea kufanya taarifa kwamba yupo mtu anayeona, lakini pili muhimu zaidi ni kwamba pengine kuzidi kuelezea taarifa hizo kwa nguvu zaidi.
This was a reason for me to continue telling non-communicable diseases stories, especially, let me say, not just for the award. The award was just a catalyst, but for me to continue telling these stories so that they are impactful, let me say that. So it was basically a push for me to continue telling NCD stories, let me say.
It was really amazing to get to know that your work is being recognized. First of all, that was the feeling I had after winning the award. And it also gave me something to, or it pushed me to even work more when it comes to NCDs, not just for the awards, but getting to put stories of real people suffering from these conditions out there.
As an organization, we do acknowledge that there are new journalists that are coming up and also joining the sector, and probably maybe specifically also will be building interest in terms of reporting for NCDs. We also do acknowledge that there are those journalists that have been consistently reporting over time. An interaction with both the new journalists and the ones that have been reporting would be key for continuous learning and also for consistent in terms of reporting and also building their capacity.
The world changes every other day. Storytelling also changes every other day. And then also the media is changing every other day. So I think training in the different, of telling a story or the NCD story in the different platforms. Apart from radio, there are also different platforms that we can be trained on how to tell the stories. I would wish also to continue being trained in these other different platforms, because the audience that we have right now are basically the youth.
For example, on TikTok, on Instagram, on Facebook, how can we basically reach them and give these narratives of NCDs in a unique way?
Kutumia wale wanahabari ambao wamekuwa kwa muda mrefu wakieleza taarifa hizi za afya, wao ndio wako wanaanza kutoa yale mafunzo kwa wale ambao wanakuja. Kwanza watakuwa kwa mfano mnaweza, yani you can relate. Umemwona pengine katika newsroom ama ushamuona katika taarifa wewe ambayo unakuja. Pili, pengine amefanya ile kazi kwa muda, anajua vipi story hii kiandikwa itaweza kwenda hewani. Maana tatizo waliko pale. Wewe utaona kwa mfano umeenda kutrain, an organization has maybe gone to train journalists, and you in your mind you're like, this is a #1 story or front page, and then tomorrow you don't even see that story. Where is the missing link? So I believe if maybe we could incorporate journalists who've been there, the veterans, to train the young journalists, I think that one will be very impactful.
Training will always remain important because one thing, there are emerging NCDs every day, which means that people have to understand what kind of conditions they are dealing with. We have different research that are being put out there. People have to understand them, which means journalists who are the bridge between the researchers or the experts and the audience have always to be aware of these emerging issues, which means they have to keep on being trained about these issues so that they can relay this message effectively in the future.
I can say it's impactful. Personally, I've learned a lot. I've learned how to package my stories. I've learned how to be intentional when packaging those stories and just picking stories that air weekly. And I can say that there is need for continued training, because media plays a great role when it comes to shaping narratives in the society.
And at the end of the day, I'm also human. So at some point as a journalist telling these stories, this might get a toll on my mental health, and I might end up being, or rather not being, in a position to tell these stories better. So I feel like the training should incorporate how we as journalists can take care of our mental health, even as we continue telling non-communicable diseases stories.
Of course, we've done much, but it has and will never be enough. It's something that we have to continue doing so that this message is in people and continues being in people.